So this was, we've had a few papers that have been small randomized controlled trials looking at nicotinamide and the prevention of skin cancer. And, the first one made it into the New England Journal of Medicine. Then there's been some, thought that, well, other studies have maybe refuted it. But this was one that was looked at, sort of done on a really big scale. So they looked at 33,000 patients from the VA system. So what does that mean? They're all going to be male and older, and they're mostly going to be white, but that's okay. So they pulled about 12,000 patients. So first of all, they picked people who had at least one skin cancer. And then they found 12,000 who had been on at least 30 days of nicotinamide, 500 milligrams twice a day, and then did propensity score matching. So matched controls, about 21,000 people. So then what they could do is then look at, incidence of skin cancer over time. So who are these people? Mean age was 77. They were 98% male, 95% white. They were pretty similar in terms of those demographics. The nicotinamide group was more likely to have had CLL, to have had a solid organ transplant, although this was definitely the minority of patients, and to have been had acitretin treatment in the past. The median number of skin cancers before starting nicotinamide was 3, but 15% of them actually had 10 or more skin cancers before starting or before going into this cohort. So what's the top line result? Nicotinamide.
So wait, just to make sure here.
Yeah.
So again, they only looked at people who had at least one skin cancer.